We later learned that a lot of these denials were because Medicare Advantage is running through medical decisions through an algorithm, using bots, listening to bots, instead of the doctors who knew my dad.
Right.
Living this trauma, witnessing this trauma, opened my eyes to the cruelty of privatized Medicare. So I'm here today to continue to fight for my dad and to honor his legacy as a social justice advocate. I know that denying my dad's care increased profits somewhere, but it stole things from us that are invaluable. Quality time together, dignity. Through all of these denials, having to continually appeal, it would continue to upend our lives and cause so much stress and trauma. So I'm here today to ask you to continue to speak out and fight for those who have passed but deserve better, for those who are with us today, that they get the care they need when they need it. No denials, no AI, no Medicare Advantage. Medicare is a social system that is supposed to be here to protect us all and provide us health care for all, and we need to return it to that.
Medicare Advantage has got to go. Medicare Advantage has got to go.
So here I am with lung cancer and thyroid cancer related to my work for the city during 9/11. And here we are, I and 250,000, 250,000 fellow retirees, many with similar stories and work-related illnesses. Here we are with the understanding that we would have our promised benefit of original Medicare and city-funded Medicare plan to carry us through our retirement. But now, when I am older, when we are older, when we already played the game and we did our jobs, when I and we made the sacrifices that our jobs required, when I worked during those anthrax events, TB outbreaks, HIV and AIDS crises to develop those prevention, counseling, and testing programs, when I already burned the midnight oil with my colleagues post 9/11 to write grants, develop infrastructure and restoration programs, radiological detection and biological warfare medical protocols, and plans to protect the city in the future. And now that I have these two cancers related to my work for the city during 9/11 and desperately need my Medicare and city-funded supplemental insurance, I and 250,000, 250,000 or more of my colleagues are being forced by the city to make new healthcare decisions that can mean life or death for each of us.
No peace, no justice, no peace, no justice, no peace, no justice, no peace.
Here's what we need Mayor Adams and the City of New York to do. Stop forcing retirees into Aetna's Medicare Advantage plan and immediately withdraw the appeal in the Benkowski versus City of New York case. Commit to honoring the promise made to retirees by ensuring premium-free access to traditional Medicare and our senior supplemental plan. Commit to not increasing the cost of health benefits to public service retirees by withdrawing your appeal to the New York City Organization of Public Service Retirees versus Campion, our first case. Immediately rescind the decision to charge retirees a $15 copay for each interaction within the healthcare system. That's our second case. We have 3 cases altogether.
Keep winning.
We have, but he still appeals every loss. We're headed up to Albany next. Hold a public town hall meeting with retirees to hear retirees' concerns and engage in good faith discussions about the future of our promised benefits. Publicly state your support for a resolution in the City Council to never strip retirees of our promised benefits, specifically by ensuring access to traditional Medicare with a supplemental plan. Publicly state your support for Senate Bill 8388 and Assembly 7866, which would prohibit public employers from diminishing health benefits for retirees by forcing them into privatized so-called Medicare Advantage plans.
Hi, my name is Sarah Shapiro. I'm here on the National Day to reclaim Medicare with many, many groups in New York City and around the country in other cities. Today, to reclaim Medicare, we want to get rid of private Medicare Advantage plans that are a danger to our health, and we want to preserve our public Medicare and We've been fighting in New York City for 3.5 years. Mayor Adams, who allegedly has enough money to go flying around the world, staying in luxury hotels, allegedly, always has the money to fight us in court. He's using our taxpayer dollars to continue to fight. He's appealing. He's lost 9 times. And we are calling for Mayor Adams to stop this malicious attack on municipal retirees who have been who worked for decades in New York City. And my organization, CROC, Cross Union Retirees Organizing Committee, believes that health care is a human right. We support the New York Health Act, which will give every New Yorker and anybody who works in New York State full-time comprehensive and guaranteed health care. Minimally, we are calling for an expansion of Medicare to cover 100% of our health. Right now, we don't have coverage for our vision, hearing, and dental. And that's the least that this Congress can do for us. We want Medicare for all. We want the New York Health Act in New York State. And we will keep fighting like we have been fighting for 3.5 years until we get what we deserve and we worked for.
Last time I was with you, you delivered a letter to the federal, right? Was it to Biden?
That was to Biden.
Can you kind of update me on that?
We got some generic answer that really didn't say much of anything. It wasn't from Biden. It was from the Medicare, I forget the name of the office, the CMA here in New York City. That letter was also delivered to other CMS offices around the country.
What is CMS? What is that? City Management Services?
No, something about Medicare.
Okay.
Sorry.
All right, I'll look into that.
Yeah. Today we do have a petition that we have gathered over 12,000 signatures. We have a letter that will be delivered to Mayor Adams, and we also have a letter that will go out to Aetna, which is the Medicare Disadvantage plan that our mayor has been trying to throw us into. These Medicare Disadvantage plans are notorious for ripping off the Medicare Trust Fund in the amount of billions every year, and they upcode. That means that they make it sound like people are sicker than they actually are, so that they can charge the Medicare Trust Fund more than they actually should. These Medicare Advantage plans are being investigated for fraud. It's well known that they have used deceptive advertising to get people to sign up for their plans, because most people get confused with the name Medicare Advantage. Medicare is not Medicare. The only Medicare is our original Medicare, and it is simply not an advantage, it is a disadvantage.
Is it the same company, Medicare and Medicare Advantage? Is that under the same? No? Oh, no?
No. Medicare is our traditional public Medicare that was started in the 60s that is like Social Security benefits. Now, these Medicare Advantage plans are simply for-profit, corporate-run health insurance plans that are masquerading as Medicare. And they get people in their plans because they offer dental, vision, and hearing. However, the problem is when people get sick and they really need treatment, these Medicare Advantage plans delay and deny treatment. And people have gotten really sick, and many people have died. because they weren't able to get the care that their doctors wanted them to get.
I heard somebody mention about AI making those decisions on who gets the care and who doesn't.
Yeah,
Can you talk about that a little bit?
they're using AI to decide. You know, they decide those questions in less than a minute, and these are not real human beings. These are computers that decide what kind of care people are supposed to be receiving. Now, we all know the healthcare system in the United States is broken. It's beyond broken. A report just came out that I saw a couple days ago. Out of all of the, most of the countries around the world have better health care than us. United States wasn't even listed, even on the bottom of their list. And this is a major problem. And if you know anybody who's been sick, especially an elderly person, unfortunately, when you get older, your body starts breaking down. And people have orthopedic issues. Some people, I know some friends with cancer. My sister has dementia. She can't get the care she needs because she doesn't have enough money. So in this country, it's a shambles what's going on with the healthcare system.
But yet we have billions for war and death and destruction.
I agree.
People can't get health care.
Yes, we got billions of dollars of bombs going to Gaza for the Israelis to bomb Gaza. Now they're bombing Lebanon, they're bombing Yemen, and they're killing innocent people with our bombs. And this country and this city doesn't have enough money to give us seniors and the disabled the Medicare that we deserve.
And never mind that Adams was just, allegedly stole $10 million from public funds. And there's money. There's obviously enough money. There's
money. This mayor, who will not be reelected, has allegedly taken money, bribes, and committed fraud from foreign countries, foreign corporations, and he's roaming around the world on our tax dollar money, and he's throwing us retirees under the bus. This guy doesn't give a damn about the seniors in this city and the citizens of this city. And we will do everything in our power. If he does not resign from these indictments where he is alleged to have committed many crimes, we will make sure that he does not get reelected. That is 100% fact.
You're a little perturbed, but the urgent care will cost you $1,572.27.
No!
Yes. Better to go to your doctor. But your doctor doesn't have any appointments for 6 months and 47 days. You have to wait. When you can finally see your doctor, she's no longer in your network. So you have to spend another 7 months and 82 days to find another doctor. Your other ear falls off. When you can finally see the doctor, he's in a rush because the private equity company that bought his practice will only allow him 1 minute and 2 seconds per patient. You quickly show him your ear. You only have one because the dog ate the other one and died. He looks at your ear and he writes you a referral to an ear, nose, and throat doctor. What? No. The ENT in your network doesn't have any appointments for 1 year and 42 days. You go on a fast to be able to afford the copay. When you finally see the ENT, your hair has fallen out. So he takes one look at you and he says, it's got nothing to do with him.
¿Cómo?
Make a lot of noise.
Let's go.
Wait. They can't cross? Oh, wonderful. That's great.
I thought you were, I didn't realize you were waiting for them. No. Go of course. They're from a distance.
They can't see because of the cars and the trucks. All right. Don't argue. Okay, all right, let's go.
The more care they delay and deny, the more wealthy they become. So it is not surprising that those of us who lie before us today represent the unfortunate result of corporate greed. A system designed to expand the wealth of the private insurance industry.